Great, thank you, Nikki. So our fourth panelist is Dr. CIRO Ugarte from PAHO, where he is the director of the Department of Emergency Preparedness and Disaster Relief since 2016. I think he's the founder of that department at PAHO. Dr. Ugarte is from Peru and has had important big official roles dealing with occupational health, emergency medicine, and disaster response, both in Peru and beyond, all kinds of disaster responses, whether infectious diseases and other conflicts and other hazards. So it's a pleasure, and we look forward to hearing your comments, Dr. Ugarte.
Thank you so much, Rima. Well, it's a privilege for me. Hello, good afternoon. Are we good? Excellent. I will discuss on the international perspective of which are the top priorities. But I would like also to mention some of the ongoing challenges that we have, including some of the perspectives, the actual risks, but also the perceived risks that we see so frequently and unfortunately that drives our decision outside the priorities that we should focus on. So for us, just to look at some of the figures, how is the evolvement of the core capacities of the countries in terms of IHR? And we see, yes, a trend, a positive trend in general in all those areas, but there are some of them that are worse than 8 years ago. So there is something that is happening. So it is not let's say going upward in all occasions. And you know, most of it is related with political will, is related with human resources, is related with changes in priority, funding, and other things that are challenging the health sector and health areas. But also in terms of the capacities by sub-regions, we see also huge difference. So just a perspective of just to imagine how the countries in each of the sub-regions, at least in the Americas, perform in terms of dealing with emergencies. And if you have low capacity to respond to emergency, the first thing is to protect yourself, not sharing information, not recognizing or actively saying we don't have that disease or delaying the process of reporting. Even though the Americas is the area in the world that has more reporting of events in the world, still we lag in several countries that reporting on events. Sometimes the delay is up to 10 days. It should be 24, 48 hours. And in some instances, never comes. Also in the pandemic influenza 2009, we had that issue as well, okay? So for us, the main priorities would be on development of institutional capacity. If we don't have institutions and governance properly designed to respond or to prepare to respond to large emergencies, we probably will be going in the same way and moving the trend downwards. The other one, emphasis on information management. Information management not only on data collection and having all this established in certain areas, but information management, including the sharing of that information. And that, unfortunately, not even the reports that we have at PAHO, in WHO, and member states are easily available for everybody, because some of them are critical, are politically driven, or are sensitive because of two things. One is the political aspect of it. If an emergency happens, of course, the fault is of the health sector or whoever is around that. And the other one is the economy. The economy will suffer. And the other aspect is the multi-sectoral approach. The health sector, as we've heard, is just one of the several actors. And in many countries, is one of the weakest actors in terms of influence, in terms of funding, in terms of even workforce and the capacity to respond in every level of the ministries. The regional solidarity, I think that is the only way to cope with many of these aspects. The Caribbean have shown us for decades how this can be done. And we have to learn from those experiences. Those small countries, small island states, are performing quite well in terms of, in general, solidarity than big countries with big capacities that even may fight each other because of other reasons, and then the result will be not helping each other. And new problems needs new resources. We cannot cope with new challenges. We're talking about the new priorities, and everything has to compete with the current priorities. What can we do? For example, in the Americas, we were able to eliminate measles and rubella. And then, of course, if we eliminate the measles and rubella, there is no need anymore to vaccinate all these people. And now we are having these outbreaks in several countries in the Americas because the vaccine coverage has dropped way below the threshold of protection. And we are dealing with that. And by the way, tomorrow, 27 ministers of health will meet at PAHO to discuss the health implications of massive migration, because all of the countries are saying it's the fault of the country who is releasing their people or is having these problems, and we are having that problem because those migrants are coming to my country. And it is not that way. It was never that way, will not be that way. And if the countries are having measles now, it's because they dropped the coverage of their own vaccines coverage. And we also identify 5 lines of action. First, incorporate health crisis response into overall disaster plans and programs. Yes, in general, we cannot cope with these issues. A couple of weeks ago, we had a meeting with 37 member states in Brasilia, having the chiefs of epidemiology and epidemic control with the chiefs of emergency management and disaster response. And when we asked them what are the top priorities, top risks for global health, no one mentioned pandemic influenza. So if they don't recognize that as a top priority, they recognize, migrants was identified by all of them. So you see, even the country that is sending more migrants in the region identified all migrants as one of the top threats, but on the other way, because more than 22,000 medical doctors left the country. That's right. Okay, so those are the issues. And we're dealing with those issues, meanwhile we prepare for a pandemic influenza. And human resources development, we change the things, but the human resources, our staff is not changing at that pace. Unfortunately, there is no way to improve that capacity all of a sudden when an emergency happens. So that's another line of action. The other provision of authoritative information, yes, we need that. Even the IHR is a mandatory law in many countries. And it is, it is one of the global responsibilities for everyone. Not everyone releases that information because of the authority that it needs to have that. And the national focal points for international health regulations are, in most of the cases, a very low level. How can you expect that a very low level in the structure of a Ministry of Health will have the authority to report on certain things without clearance of the political levels or others? So that's very difficult. The other one is strengthening laboratory capacity. Yes, as I mentioned in many meetings, we have, 80,000 reported associated with deaths associated with pandemic influenza, or for influenza, sorry. But in the Americas, you see all other countries. I asked all the other countries, how many? I said, why, are you immune to influenza? We are happy because we don't know why are we dying, So there is a problem there. There is a capacity in the laboratory diagnostic everywhere. And yes, it has to be easy to do, but then we have the challenges of having those issues performed. And the other one is the early warning, surveillance, and response all together. Yes, for every event, It cannot be just for one event or 2 events, 3 events. In the emergency program at PAHO, that actually was created in '76. And I'm the director of health emergencies since 2016, where the emergency program at WHO was created. So we adopted that. And then WHO changed the name to emergency preparedness back. So we don't know where we are now. But the thing is that in those terms is all the things that are related with early warning, surveillance, and response are allocated with one group of people. And they are the ones responsible. They are receiving all the support so they can perform their work together. We need to improve the coordination about international actors, because clearly the goal is the national and international preparedness and response capacity are both critical. And we don't reach the level of national capacity yet. So we're in the sense of blaming some of the countries. And we have several actors, and all of them are there. And you see more coming when there is an emergency, but today we have many of them operating inside the countries, outside the countries, in sub-regions, in the world, and we don't know what's happening. So the real challenge is the coordination. Everybody wants to coordinate, but nobody wants to be coordinated. So you see each of those institutions have its own mandates, sometimes self-mandated aspects, and their own protocols, their own ways of doing things. How can you mix those things? It is extremely difficult. So in that regard, the coordination, just to see some of the lessons learned from pandemic influenza, we saw the United Nations agencies were important partners during pandemic influenza preparedness. Yes, many of them during preparedness. All of them were around. But during the pandemic influenza in Mexico, all of the UN agencies requested to release all their personnel, so they reduced up to 75% of their staff. Meanwhile, PAHO and WHO was increasing more than 700% their staff there, even without the proper security clearance from the UN. And also we have the GORN. The GORN missions coordinated by PAHO were useful in many countries for preparedness. During the emergency, we had problems with that. Mexico couldn't deal with that. I had to deal with Russia, France, US, Canada, and many other countries. And each of the countries, of course, want to have, even though they are part of the GORN, Global Outbreak and Response Network, they want to send, let's say, critical information or sensitive information back to their country, so the countries will be better prepared. And some of those may not be transparently done. So we had to ask some of those actors, because Mexico couldn't do that. I had to ask some of those, please go back to your country, you're not welcome anymore. Because they were working under the table, hiding some information, and sending information without the proper clearance. And I had a fight with a Russian delegation that was not a medical doctor, was a military guy, that wanted the sample of the vaccine, or the virus, to make the vaccine. And he was saying that in 2 months he will deliver a vaccine. It was crazy. So we need to better coordinate with UN and other actors in that regard. Where do we go from here? I think the political endorsement of guidelines and improving the quality of international cooperation is a must. And yes, it has to do with governance, but it has to do with political will and good institutions that will step up over some crazy political wills. We need to maintain that level. If we don't maintain that level, we are lost. To ensure coordination among specialized organizations, agencies, centers, and others is another key aspect that will go from here. Establish operational coordination procedures with national, regional, and global initiatives. It is also another thing, but as I said, the priorities go somewhere else. And I came just before this panel because I was discussing on the agenda of tomorrow's meeting with the ministers. And all of them are discussing on the health implications of the migration, particularly on communicable diseases. But we need to avoid some traps. Time-consuming meetings without operational impact. What do we get from here? What do we get in tomorrow's meeting with the ministers? They are coming here. 27 ministers are coming from 30, and 37 countries will be represented. What they will take back to their countries. So inappropriate emphasis, for example, on visibility rather than excellence, and convenience rather than effectiveness, and ambitions that are not supported by available resources. Unfortunately, we probably need to dream less and sleep better. And there are several aspects that we cannot cope with those list of wish lists, you know, in terms of in areas where we have some constraints. So the final goal for us is to enhance national and international capacity, strengthen and complementing the local response capacity, and improving the quality and appropriateness of external assistance. We cannot lose the opportunity of an emergency, being it real or perceived by a country, to build for the future. Because in those emergency situations is when the politicians and some other persons are aware of that, and they are listening to us. And the last aspect is that we have a big challenge to translate health issues or impacts into political and economic language. We don't do that too frequently, and we're missing the point. Thank you.